If you could please put the data slide up on the screen. As far as it goes, this is a reasonably good news story in terms of the COVID data. Yesterday, we saw 823 new cases out of about 16,500 tests for a percent positive of 5%. I want to remind you that the last time I was up here, a couple of weeks ago, our percent positive was nearly 10%, much higher than 5%. So I have to say thank you to the people of Rhode Island for obeying the pause, for keeping it safe and local over the holiday. 5% positivity is where we want to be, and it's significantly better than where we had been 2 or 3 weeks ago and in the week leading up to Thanksgiving, so thank you. At this point, the virus has infected more than 100,000 Rhode Islanders and taken the lives of almost 2,000 of our friends and loved ones, and my heart goes out to everyone impacted. I have talked to many of you who've lost a mother, lost a father, lost a dear loved one. 2,000 Rhode Islanders have perished, and my thoughts and prayers and heart and sympathies are with each and every one of you. Rhode Island continues to lead the nation in testing. I'm proud of the fact that we've performed almost 2.2 million tests. That's the equivalent of more than twice our population. Last week, we tested over 100,000 people. To me, it seems like it wasn't long ago that I was here telling you we were going to try to test 400 people a week. Now we've tested millions, and we have a leading testing infrastructure in America. At this point, we're vaccinating thousands of Rhode Islanders every week. As of today, 7,446 Rhode Islanders have been fully vaccinated with the 2 doses, and another 38,197 have received their first dose. And we expect that pace to really increase in the coming weeks and months as manufacturers increase. That is fantastic news. The fact that we've already vaccinated, at least initially, nearly 40,000 Rhode Islanders, and we have a plan over the coming months to stay at a steady clip of vaccinating people it's just a fact that you can see the light at the end of the tunnel. Once we are to a place where everyone who's at high risk is vaccinated, you know, everyone in a nursing home, all of our healthcare workers, everyone over a certain age, we have much more flexibility on our ability to continue opening the economy without worrying that our hospital system will be overwhelmed. So I cannot emphasize enough, as Dr. Chan says, this is the beginning of the end of COVID. The vaccinations are here, and we have an excellent system to get them out, and they are highly effective. In the weekly data, the dashboard in front of you, you see 374 new hospitalizations. I want to point out to you that is the lowest number of new hospitalizations since mid-November. So again, we are not out of the woods, and I need everyone to stay vigilant, but I am relieved to see a 5% test positivity and the lowest number of new hospitalizations since mid-November. And I again want to thank our hospital leaders and frontline staff for your incredible work from day one. New cases per 100,000, another metric we look at, is slightly up to 752 as a result of increased testing, though, which is what we want to be doing. And again, I've already said, you see a big drop on the data before you in our percent positivity down to 6.6%, which is now the 6th lowest in the country. So I would say we're on a good path. Hospitalizations are stabilizing, test positive is coming down, test positivity, which is really what we look at since Rhode Island is so far ahead of the pack on testing, is in a much better place. So where do we go from here? Stay the course. Stay the course. We have, as I said, we have systems for testing, very, very robust. Contact tracing, we have no backlog right now in our contact tracing system. We have hired rapidly hundreds of people over the past 2 months. There's no backlog in K-12, which we did once have, or in the state's contact tracing system. And we have really ramped up our quarantine and isolation supports in the past couple of weeks. I can't overstate this enough. We now have a system which is reasonably seamless. You know, at the time you get tested, if you test positive, we can offer you support right then and there. Do you need a hotel if you are unable to live in isolation in your home? Do you need food delivery? So we have these systems. They are well functioning and robust. We have worked 24/7 over the past 10 months to operationalize and put those systems into place, and now we have to let them do their thing and stay the course. In the past month and a half, we have focused on increasing testing capacity, getting deeply into the hardest hit communities, leveraging new technology. Many of you, if you've been diagnosed, you see the text. We'll send you a text message, or we'll tell you you've been in close contact. We're increasing our access to the new treatments, which are highly effective, and of course getting vaccines. So the state, we have to stay the course with these systems, and everybody in Rhode Island cannot let their guard down. Stay vigilant. Keep wearing your mask. Stay socially distant. Wash your hands constantly. And we will continue to do testing, treatment, and vaccines. With that winning formula, we're going to get to the finish line in the coming months. I have been up here offering a message of protect your household. I'm going to continue to hammer home that message. After the pause ended, and the pause was very effective and well-timed right after Thanksgiving, so thank you, we started to slowly dial the economy back up with this framing principle of protect your household. Let's stick with that. You can go out to dinner. In fact, it's good to support local businesses. You can go to the store, you can do your errands, but please do it with the people you live with. You know, go to dinner, go to the store with the people you live with, and of course, wear your mask. As a result of the fact that it's working, I'm extending the current guidance for another month through mid-February. So the existing guidance, I'm going to re-up that executive order, and the existing guidance will stay in place for another month through mid-February. I want to make a special note about school sports. The existing guidance staying in place for another month impacts school sports. So I do want to say very likely we'll be back out next week with specific guidance around school sports and youth sports. We're working very closely right now with the Interscholastic League to see if there are limited changes that we can make to school sports to allow the kids to play. So existing guidance in place for another month, with the footnote that hopefully in a week we'll have an amendment to that in coordination with the Interscholastic League that relates to school sports that allows the kids to play. And we're doing that also in coordination with Massachusetts and Connecticut and our neighboring states. I want to take a minute to talk about K-12. One of the keys to protecting our household is to get tested often. At the last press conference before the holiday, I gave everybody a goal. Get yourself tested twice. Once, maybe once before Christmas, or once before the new year, or once after the new year. I hope you're able to do that. The good news is by early December, we were averaging 12,500 tests per day. I want to continue to urge you, please, get tested. Get tested, get tested, get tested. It's one of the most powerful tools in our toolbox to contain the virus. I'm going to set another goal here right now. We're at 12,500 a day now. Over the next month, we are doubling our testing capacity to 25,000 tests a day. We will have the capacity. Now it's up to you, the people of Rhode Island, to come out and get tested. It's on you to go out and get a test. In order to make it easy for you, we are launching more drive-through rapid testing sites where you can get your result within 15 minutes without even leaving your car. You're going to start to see more of those popping up, so it should be very easy. On your way home from work, stop by one of the drive-through centers, 15 minutes, get yourself tested. We're also working very closely with workplaces to bring testing to workplaces. And I want to thank the Chamber and the Rhode Island Manufacturers Association and other business associations for helping us access your members. We want to make it incredibly easy for you to get tested. At work, get a test. We're going to do the same thing in schools. You're going to see a massive ramp up in testing in the coming weeks at schools. We want to have regular testing of all students, all teachers in schools. It's what teachers and students deserve, and I want to thank the school leaders for working with us over the past 3 weeks. Again, we want to really ramp up the testing in schools and in neighborhoods. So one of the best things you can do as an individual, as a parent, as a student, as a teacher, as a mother, as a Rhode Islander, is to get tested frequently. And what we are doing on our end is making it easier and in your community. So again, we're at 12,500 today. A month from now, let's be at 25,000. To sign up for a test, take out your phone and go to portal.ri.gov. Portal.ri.gov. If you got tested last week, get tested again next week. If you got tested over Christmas, get tested again. If you go out for dinner with some friends and it wasn't your household, it'd be good if you didn't do that, but if you do, go get tested. If your kids were playing around with they come home and they say, Mom, I was with my friends, maybe I shouldn't have been, go get them tested. Portal.ri.gov, we're adding supply to the system. We want you to get tested. It's free, it's quick, it's easy, and it's an incredibly powerful tool. Last thing I want to say relates to schools specifically. Last month, we ran testing pilots at schools across the state. We tested in these pilots more than 900 students and staff. We found a percent positive of less than 1%. I want to say that again. We tested nearly 1,000 students and staff at a variety of schools last month, in the thick of this, and we had a percent positivity of less than 1%. So what does that tell you? Schools are safe places to be. That's just a fact, at least in Rhode Island. You know, due to the incredible hard work of the National Guard, the state team, the Department of Health, our command center, teachers, parents, principals, superintendents, schools in Rhode Island are safe places to be. And we're ramping up testing in the coming weeks and months. So as we start bringing kids and teachers back to the classroom, I want parents and teachers to have confidence that schools are safe. We've been at this now for months, and the proof's in the pudding that these are safe places to be. As we roll out the regular testing of asymptomatic people, teachers and students, schools will become even safer. We are giving the schools the training and materials to run the tests. And in some cases, we're sending them teams to do the testing. So if you're a parent or a teacher and your school hasn't yet announced their plans for asymptomatic testing, you should call them. We are, of course, not forcing schools to do this, but I believe every school should do this. And what we're doing is we want to make it as easy as possible to do it. So if you are a principal and you haven't yet figured out how you're going to be testing in your school, please reach out to us. Reach out to us. We want to help you. If you're a parent and you haven't heard anything about the new testing for your children's school, or you're a teacher, and this is news to you, you haven't heard about more testing and new testing, then you should call your school, because we are deeply committed to making sure that we have regular testing of all asymptomatic individuals in schools in the coming months. To the school districts that continue to not let their children into the schools, particularly the youngest kids, I'm going to ask you yet again to reconsider that decision. If you're in Pawtucket or you're in some places where you are denying your children their right to an in-person education, a high-quality education, particularly the youngest learners, I'm asking you again from the bottom of my heart to reconsider it. Schools are safe, less than 1% positivity, 5 months of data, and a whole new testing regimen that we are putting into place. And what we're going to aim to do is make it simple, easy, like a turnkey system for testing. That's what we want to try. To those of you that stepped up and did the pilot, thank you. It was incredible. And it actually was even smoother than we thought, which is great.